DVT stands for deep vein thrombosis, and this relates to the formation of clots within the veins, which is one of the important blood vessels in the body. And more commonly, people will refer to this as blood clot in my legs. DVT, or deep vein thrombosis, most commonly occurs in the legs, but can occur in any of the deep veins of the body, such as the arm and blood vessels within the abdomen. There are three general established reasons why somebody would form a DVT, or deep blood vein clot. And those relate to something that makes the blood flow abnormal, so the flow is slow, which would lead to formation of clots. The second would be some abnormality within the blood itself that makes the blood more sticky or more prone to forming clots. And the third would be the presence of something that damages the inner lining or a direct injury to the vein. Those all are the factors that can lead to the formation of a clot, which is not a normal process. Our body has a very well-established mechanism that keeps the blood from clotting, and that relates to its ability to flow consistently, and the body is constantly working to prevent clot formation. It's when this gets disrupted when we find that blood clots will form. By far and away, the most common cause and the most common reason for forming blood clots is that the blood flow itself is abnormal. So we might see somebody who has had major surgery and they are not moving around a lot, or they're not what we would call ambulatory. And this, along with the ongoing illness a patient may have, slows the blood flow in the veins and can, in some cases, lead to blood clots. Now, fortunately, this is rare, and there are things that we can identify, or situations that would make you more prone, that we can therefore provide preventive mechanisms to prevent blood flow. So, for example, when you undergo major surgery, which is a risk factor in some cases, we put devices on your legs that keep the blood flowing consistently, in addition to sometimes using blood thinners to help prevent the blood clots from forming. The main goal is to prevent the formation of blood clot, and if one happens to form, is to make sure that we identify what it is, where it's located, and then form a treatment plan, which is to predominantly prevent the formation of additional clot or prevent complications such as the clot leaving its area in the leg and going somewhere else, which could be the lungs, and we commonly call that a pulmonary embolism. Once again, fortunately, these are rare, but at Novant Health Vein Specialists, we have extensive expertise to identify, diagnose, manage, and counsel to prevent the ongoing potential complications of deep blood clot, or DVT. Treatment options for deep venous thrombosis, or DVT, relates predominantly to, number one, preventing the clot from continuing to form. Number two, preventing the clot from going somewhere where it's not supposed to go. And number three, preventing the long-term potential complications or problems associated with blood clots, predominantly in the legs. So let me address each of these. First of all, the main goal is to prevent the clot from forming any further and from growing larger where it is. And this is most commonly accomplished with the use of blood thinning agents, or anticoagulants. We have a large list of potential anticoagulants, many of which can be used in an outpatient settings, but occasionally require hospitalization to manage appropriately. The second is to prevent the blood clot from not only growing, but going somewhere where it's not supposed to, such as breaking off and forming an embolism or pulmonary embolism. Once again, the most common method to prevent this in almost all of the cases is to provide adequate blood thinning. As long as the blood is thin, the risk of the blood clot leaving where it's formed is very, very low. There are situations where either the treatment fails, or we have concerns that we are not able to provide the adequate treatment. So therefore, we might place an IVC, or vena cava filter, which goes inside the large blood vessels in your abdomen or chest to prevent blood clots and capture them from going to your lungs. Once again, the need for this is relatively rare, except in certain cases. And finally, the topic of what we do to prevent the long-term problems is an important topic as it relates to your vein disease. Many of the problems that we'll see at Novant Health Vein Specialists relate to people who have had blood clots many years before. And we know that the presence of blood clots in your legs can lead to permanent damage to the inner lining of the veins that over time leads to what's called post-phlebitic syndrome. This is a failure of the valves in the vein to do what it's supposed to do, which is keep blood flowing from the feet and legs back towards the heart. And over time, this creates pressure in the legs, which can lead to some of the common problems we treat at Novant Health Vein Specialists, such as venous leg ulcers, skin changes, and varicose veins. The prevention of this, however, after identifying a deep vein clot, is the use of graduated compression stockings, ongoing appropriate length of anticoagulants, and close monitoring, all services that we provide at Novant Health Vein Specialists.